Good morning, and welcome to Dr. Murphy's Public Health for You series, where you can ask questions and hear the latest news. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He'll be addressing the latest headlines through today, January 23rd, and we welcome any questions or comments down below at any of our linked social media or the comments section. Starting today around the seasonal influenza, pediatric flu deaths have shot up once again. Can you tell us those numbers and about the general state of the flu, Dr. Murphy?
Well, the general state, this is the worst 2 months, January and February, for COVID, flu, and RSV, which are potentially lethal viral infections. And there's vaccines for all of them, and there's treatments for a couple of them. So, of course, some of our most vulnerable people in the country are small children, especially very young children. And there were 15 deaths in January so far. So, and there's in the entire season, it's up to 32 pediatric deaths. Children can die from this disease. The old recommendation was that everybody 6 months and older should have the vaccine, and that's now in question. And then we have this very virulent flu virus floating around, H3N2, which is nastier than the usual ones that come. And you put all that together, and you've got an estimate 18 million illnesses, 230,000 hospitalizations, and 9,300 deaths overall. So it's mostly adults that are dying, but still you have the 32 children. And you look at the Stanford University wastewater monitoring, and they're finding very high levels of influenza A, RSV, that's respiratory syncytial virus, and COVID. So it's just rampant.
Mhm. Following up on that vaccination note there are two very big stories this week that will wrap up into one.
Mhm.
First, how is the flu vaccine matched up to that current virulent strain? And also, how might the United States' decision to fully withdraw now from the WHO affect that in the future?
Yeah. Yeah, these questions are really tied together. So what happens is the WHO monitors flu around the world. We monitor our own flu in the country, but this thing is it's a global phenomenon. And typically what happens is the flu outbreaks in the southern hemisphere in their winter drifts up into our winter. Now this year they didn't notice that H3N2 variant. And so the vaccine that was made was basically for the usual type of flu virus. So that's one problem. And that was nobody's fault, but it was just it the H3N2 showed up too late. They couldn't, it's not like you can just manufacture this stuff in 30 days. So that has been a big problem. But the vaccine is still efficacious. So it's, approximately 57% effective in children and in adults. Looks like about uh, somewhere between 45 and 27% effective in multiple studies. And that's not that atypical. Uh, Usually it's about 50% or a little bit better. And that helps because if you're talking about 18 million people getting infected so far. Um, if at least half of the people are getting some type of protection, that's a lot of bodies. That's a lot of bodies. In other words, without these vaccines, instead of 18 million, there might have been 30 million, something like. I mean, it's just an estimate. But so it is effective, but you have to look at it at the population level. And that's the way it goes. And now that we have officially left the WHO, the WHO claims we're $130 million in arrears in our dues. So we're going to be isolated from all this information unless we go out and find it ourselves, which we're not going to do because we've cut everything back so much. It's really the wrong time to leave the world. First of all, we can't leave the world. The world is interconnected, whether you like it or not. There's so much travel back and forth, people moving around that, and that's how these things, these viruses are completely apolitical and cross national lines very easy. You basically can't keep them out. It's impossible. Um, Remember with COVID in Australia, they were so strict. They quarantined everybody for 3 weeks in these like camps, and it was just they had the most severe, um, you know, infection control measures. And then, so they had, very low rate of COVID. They ultimately all got vaccinated for the most part. And then they stopped all that. And then they had a big bump of COVID. Same thing happened in China. They were also very strict. But it's it's going to spread everywhere. It's impossible to isolate from a respiratory type infection. You are in the world. It's a global phenomena. No amount of blocked immigration or restricted travel is going to stop it. It's going to come no matter what. So
Hmm.
it's a very foolish, short-sighted thing to do.
Yeah. And speaking of things that are spreading wildly, the measles update we just got this morning, another huge surge of cases, as well as those continuing outbreaks still going on. Can you bring us the latest?
Yeah, this is actually getting worse. So there were 88 cases just in South Carolina alone. There were 416 total in the past week nationwide.
I think that's
Um,
416 total with
oh, total, right.
245, which is huge in one
Mhm.
week.
Right. So it's very, very unfortunate because this is a completely preventable disease. And overall, the vaccine rates for measles have been slowly declining. They're below 95%, which is the amount. Measles is so contagious that you have to have 95% coverage, which we had for many, many years. In the year 2000, we had zero measles cases. Now we've got, these hundreds of cases in just 1 week's time and whatever. And remember, measles can get kids sick enough to end up in the hospital and can die. So we have still just the three deaths in the United States, but there will be more if as long, it's just a numbers game, and the numbers are getting higher.
Hmm.
Not
And
going to go
there,
away as long as the vaccine rate is this low.
absolutely. And on that exact note, there was some research groups that followed up into those numbers to try to identify some of the vaccination gaps. Where are these very low vaccinated groups? Can you tell us
Yeah,
that?
yeah, it varies. It's there's huge differences. The Northeast and Upper Midwest are generally high, but there are places where coverage is way below what is needed. These include West Texas, Southern New Mexico, Northern Arizona, parts of Mississippi, and really the entire rural southeast of the United States. So, those areas and the trends are going that the vaccine acceptance rate for measles is going down, and that will continue. And that means that this measles epidemic is never going to go away. It's just we're going to just be reporting hundreds of new cases every week because virtually all those unvaccinated people are going to get it.
Hmm.
It's just going to take a while to infect them all. I mean, when I was growing up, the measles vaccine came out when I was a kid. But like before that vaccine came out, everybody got them. Everybody had it. The whole school, everyone, everybody got that. Everybody had everything, and a lot of sick kids.
Hmm. And that's a very important note. In South Carolina, where that large outbreak is happening, community transmission is being fueled from the elementary school level all the way
Yeah.
up to colleges and universities. So,
Oh yeah.
if you're not vaccinated, you can definitely still get it no matter how old you are.
Yep.
Our
And
final
actually,
story.
some of the older ones I get it. I mean, they get really sick.
Yeah, one of the three deaths was an older adult and two
Right.
young children. So very
Mhm.
sad.
Yeah.
Our final story today is a follow-up of something we touched on briefly last week, but there have been at least 45 people sickened with salmonella following an outbreak linked to a supplement powder. Can you give us all those details?
Yeah, so we mentioned this briefly last week. There's a supplement powder up there called Live It Up Super Greens, and they have flavors. One is called Original, and one is called Wild Berry. And unfortunately, they're contaminated with listeria. Excuse me, with salmonella. I'm sorry, I was thinking about another outbreak we had. But salmonella, people can get very, very sick from salmonella. You can end up in the hospital. And it's really bad. So there have been clusters of cases in Wisconsin, Kentucky, Illinois has had 4 cases, Ohio, and Minnesota. And if anybody has this dietary supplement called Live It Up Super Greens, get rid of it. Don't give it back to the store and get your money back, or throw it away in the garbage, please. It can get you very sick.
Not worth the risk there. But on that note,
No, no, that is the powdered supplement. No, it's contaminated with
Mhm.
salmonella. So,
On that note, I'd like to thank you, Dr. Murphy, for your time and your expertise, bringing all this most important information to us and helping us actually understand it as well. So thank you and have a great weekend.
yeah, have a great weekend. Stay warm.
Stay very warm. And if you have any other questions or comments, topics you would like to see discussed, please feel free to leave them down below or contact us via any of our social media linked in the description. Have a nice weekend.